Hello, I'm Tamara Pope, Vice President, Marketing and Communications at Hamilton Health Sciences Foundation. As our Innovations in Vital Care series continues, we hope that you are enjoying hearing from some of the experts at Hamilton Health Sciences. For this week's episode, our focus turns to the process of rehabilitation. While rehabilitation services take place across Hamilton Health Sciences, the Regional Rehabilitation Centre is the one location that provides specialized care to help patients recovering from spinal cord injury, acquired brain injury, trauma, stroke, and orthopedic surgery. This center provides care to patients from Hamilton, across South Central Ontario, and from across the province. Tricia Illman is a registered occupational therapist in the Adult Wheelchair and Seating Clinic. Today, she'll be speaking about the important work she does with patients. For today's episode of Innovations in Vital Care, it's my pleasure to introduce Tricia Illman.
I'm really excited about this opportunity to share some of the exciting work and endeavors that we're doing at the Rehabilitation Centre. And so thank you for allowing me to do this today. My name is Tricia Illman. I'm an occupational therapist and I am working in the Adult Wheelchair and Seating Clinic at the Regional Rehab Centre. I've worked for Hamilton Health Sciences about 26 years almost, and primarily in rehab. And for the last several years, my focus has been in the adult wheelchair and seating clinic for the populations that we work with there. And I'll be sharing more about that as we move through our slides today. When we look at what is rehabilitation, so focusing on patients and families coming at a really difficult time in their lives. They've experienced some sort of medical event that has contributed to the need for rehabilitation. Families work together with their patients on a multidisciplinary team, really to optimize their function and prepare them for discharge to the most appropriate setting. We know from all the research that's out there that participation in an intensive and specialized rehab program, such as some of the services that are offered at the Regional Rehab Centre, really provide the best outcome for our patients as they move through their continuum of care following such a major medical event, to allow them to reintegrate back into their communities, back into their homes in a most successful way, and improving their quality of life. We talk about this multidisciplinary team, and certainly there's many members to the team, and many members contribute to the care of our clients. Looking at anyone from a physiatrist, nurse, physio, OT, all those allied health professionals, pharmacists, all the assistants that work, whether they're an OT, PT assistant, a pharmacy tech, our rehab therapists, our recreation therapists, the pool, the hydrotherapy that is being provided at the regional rehab for some of our outpatient patients is fantastic. Our SLPs, our speech language pathologists, communication disorders assistants, social workers, psychologists, and then our spiritual health care professionals as well. So it really does take a team to meet all the needs of our clients. And that's the exciting part of working in rehab is that we work together, common goals, with the ultimate goal to get our clients home, to get them safe, to get them as independent or able to direct their care in whatever way they're able to. So just a quick little picture there of the Regional Rehab Centre. So it is located adjacent to the Hamilton General. We're attached via a nice little bridge. In the winter, we can get across that way, or out through the courtyard, which I'll show you a picture of in a minute. Certainly the rehab program moved down to the Regional Rehab Centre in 2009 when the building was built, and we were able to consolidate many of the rehab services on the one site, which was a great endeavor just over 11 years ago. Within the rehab center, there is inpatient and outpatient care. You know, we talk about the Regional Rehab Center, and one might wonder, what do we mean by regional? And certainly there is the idea of regional care within our, regional healthcare teams, changing the names in the community. The one's called the LINs, now they're calling healthcare teams, and really looking at sort of that Hamilton, Niagara, Haldimand, Brant area, as well as the Wellington County area. Guelph, Waterloo is part of our regional catchment. Local, and I'll talk to which programs focus in those different catchment areas, is really just Hamilton. You live in Hamilton, you'll receive care locally for the specific programs that we have local care for. And provincial really is our ABI program, our acquired brain injury program, provides some services to clients in more remote areas with respect to their specialized service area. Here's a few little pictures here of some of the exciting environment, very therapeutic environment for patient rehab at the Regional Rehab Centre. We have our hydrotherapy program, our therapy pool, driving simulator. Part of our outpatient services does look at driver rehab and looking at assessing for our clients' return to driving as per the referral from their physicians. The outdoor wheeling track picture there, we really love that. We're really proud of that environment. And certainly in the wheelchair and seating clinic, we take patients out there to practice their wheelchair mobility. If gait training, ambulation retraining is part of the program, certainly they go out to that wheeling track. There's a variety of different terrains. There's grass, there's cobblestone, there's wood, there's steps, there's ramps. So it really gives us a real live sort of simulated environment of where our clients may be going when they're in their wheelchairs, navigating different environments, as well as they're learning to ambulate in a new way, perhaps with a gait aid, perhaps with a new prosthetic, depending on their nature of their disability. So really, it's a very therapeutic environment that really promotes a good environment for patient rehab. The Regional Rehab Center has 2 floors of inpatient beds, and in total there's 74 inpatient beds. And those patient populations that are housed for rehab in the Regional Rehab Center are clients that perhaps have had a stroke. That is definitely a local program. So our catchment area for clients who've had a stroke and require the rehab services at the Regional Rehab Center would be local to our Hamilton community. Our spinal cord injury and our amputee programs are certainly more regional and local. So they would be coming from those regional healthcare teams as well as Hamilton local clients. And the acquired brain injury is a very specialized program that's on the 3rd floor of the Regional Rehab Center, and it has catchment area locally, regionally, and some provincial, depending on client needs and depending on availability and other acquired brain injury programs. So really, we can see the vast client population that we treat and assess here in the Regional Rehab Clinic, Regional Rehab Center, and we can see where the catchment areas are for these clients. I'm going to focus now in on the outpatient services because that's really where my area of focus is, and there's been some exciting endeavors happening in the seating clinic and in light of our current landscape in this pandemic world. So we're really going to take a closer look on outpatient care. Definitely based on eligibility criteria, outpatient care is offered for a variety of needs and a variety of client populations. Certainly there's a continuity of inpatient care. So those patients who are seen in inpatient, perhaps they've had a stroke or a spinal cord injury or an amputation, they are then seen inpatient and then discharged into their community and then would continue their outpatient care in our outpatient area. Those clients that are coming into the outpatient program at the Regional Rehab Center for their allied health, such as OT, PT, speech, you can get your pool hydrotherapy as well during that outpatient stay, would be clients mainly who live locally. They have to be able to come to the center. They have to be able to drive there and participate, usually 2, maybe 3 times a week, depending on what their assessed care needs are for an outpatient program. Ultimately, our goal is to have those clients move out of a particularly formalized therapy program and incorporate those exercises and those routines into their everyday life to continue to maintain their level of functioning. So certainly we're seeing a great deal of continuity of care with our patients coming through into our outpatient area. There are other sort of specialized clinics that are available in our outpatient area. I'm going to talk more about the wheelchair and seating clinic, as that's my program, but there are other outpatient services, community programs, outreach services. The prosthetics and orthotics program is a huge clinic service that is available to our patients on an outpatient basis as per their need. The hand clinic, there are many services at the Regional Rehab Centre. The Adult Wheelchair and Seating Clinic is a really unique clinic for clients who have complex postural and mobility needs. We see clients of a variety of different diagnostic populations, and I've named a few there as far as some of the populations that we see. They may be clients that have come through the center already with respect to their spinal cord injury or their acquired brain injury. They may have come through, we may be seeing them at the time that they're in for their other allied health mobility or therapy services with respect to physio or speech, or we may be seeing them just on our own. Our catchment area certainly extends into that regional component as well for the Adult Wheelchair and Seating Clinic. So we do see clients that come locally from Hamilton, but we also see them coming from, the Niagara area, Halton, all those different areas as well around us, as long as they can come to us. So we are an outpatient clinic. Clients need to travel to us. They need to be able to get here, whether that's with public transit within Hamilton or whether that's a family member driving them if they're coming from outside the city. So certainly that is one of the criteria. We need to make sure clients are able to come to us. Clients are seen for complex posture and mobility needs, and I'll talk a little bit more about that in my next slide. We're seeing patients at their vendor of choice location as well. When I talk about a vendor of choice, that's their wheelchair and seating vendor. So it's the supplier of the equipment that they are going to be prescribed by myself through the assessment, and they will be meeting the needs of their clients by providing them the equipment. So we are starting to see clients at the vendor's location. I'm an occupational therapist, and I'm one of 3 on the team. There's 2 other therapists that work together with me, Deborah Cox and Diane Tate, both who are also registered authorizers with the Ministry of Health Assistive Devices program. So that is the part of the equation for our clients who come in for assessment for their wheelchair and seating needs, the funding part. And in Ontario, we're fortunate that the Ministry of Health does provide government funding for prescribed devices that have been prescribed by a registered authorizer, such as myself or my other 2 colleagues in the seating clinic. The government in Ontario will cover up to 75% of the cost of the wheelchair, and then the client is the remaining 25% is the responsibility of the client, unless they are in receipt of Ontario Disability Support Benefits, the ODSP program. Then the government actually pays 100% of their cost. And when some of the chairs we're talking about cost the price of a small car. Some of the chairs are up to $25,000. Definitely the government helping with the funding is definitely a benefit for our clients getting their needs met in the best manner to have the device that will meet their needs the best way. As well in our seating clinic team is our occupational therapist assistant, and they are an integral part of our team to help augment our patient care and support the needs of our client population as assigned by the occupational therapists. And another part of the team, as we've already spoken about, is the wheelchair and seating vendor. This is the client's choice of who they work with, so we provide them with a list. This is outside of Hamilton Health Sciences, but they are an integral part of the team. We need to work together with them. That would be whom the client would purchase their equipment from based on the assessment that happened in the seating clinic. So our process of assessing their most appropriate needs really is enhancing their quality of life, their ability to get up and move safely. It's preventing them from perhaps having to go to hospital for surgery, and it's keeping clients home safely. And in current world of this pandemic that we're living in, we certainly want clients to be at home and to be safe and to prevent hospitalizations. So certainly the positioning, the seating and positioning and the mobility system really enhance a client's function as well as their overall sort of physiological functioning within their overall systems, and being able to sit in their chairs longer and function and interact with their environment and their family. Just another area that we do quite a bit of work on is looking at that pressure mapping system. So we have a pressure mapping system that we can actually look at how a client is sitting in the chair with a mat that sits on their cushion and on their back support. We can see where they're bearing weight. Is there an area where they're sitting there where there is more pressure that puts them at higher risk for developing a pressure injury, for developing a wound that could cause a lot of subsequent issues of medical concerns. So we're able to pressure map them and get a real read of where their pressures are. I hope that that's given you a real sort of overall view of the care that's being provided at the Regional Rehab Centre, that interprofessional care and the value to that. You know, that we're seeing patients from a local, regional, and even provincial in some of our ABI programs, in our inpatient ABI. And then the bird's eye view into that adult wheelchair and seating clinic as an outpatient service of our RC, and see where we're meeting the needs of those individuals with complex postural and mobility needs.
So thanks so much, Tricia. That was really interesting. And I've had the privilege of meeting and interviewing a lot of very grateful patients who have received care in the Regional Rehabilitation Centre. And one thing that always comes up is the fact that they appreciate that the immediate family is also very much involved in the care. Could you maybe speak a little bit about the idea of family-centered care?
Yeah, definitely. I think you're right. We'd like to involve families. We like to involve them in their care. We like to involve them in the process of whatever activities we're working on. I think I gave the example of, you know, rehab is one part of their continuum in care. They come from inpatients, they come to outpatients, but ultimately at some point we have to sort of let them loose, and they need to integrate whatever exercises that are considered therapy now becomes their everyday activities that they need to maintain and do, so that they maintain their progression, they maintain their level of functioning that they've achieved through that continuum of care. And certainly a lot of clients require assistance with that. They require assistance with their exercise program. They require assistance to be transferred in and out of their wheelchair and positioned properly to be able to function in that chair. And so involving the families in their rehab will only improve that outcome and those clients being able to be discharged and maintain their level of functioning and the gains and the goals they've achieved in their rehab process.
And Hamilton Health Sciences Foundation is very committed to raising funds to help ensure that the teams at the Regional Rehabilitation Centre have the equipment and tools they need to provide the best care possible. If you could give a message to donors about the importance of supporting the foundation, what would you tell them?
Yeah, definitely considering our clients, the quality of life that can be improved by a client being able to participate in an effective rehab program is huge. For clients who don't have the opportunity for whatever reason to come through a rehab program such as we have at the Regional Rehab Centre, I really think that their quality of life, their outcome, their ability to function and be productive members in whatever roles that they are carrying out in society can really be impacted if they have not had the opportunity to participate in a rehab program with a multidisciplinary team, with a lot of the technology and supports that we have at the Regional Rehab Centre. So definitely for clients, improve quality of life and functioning and being able to leave their rehab stay and continue on in those roles that are important to them. That is really the main focus, I think, for us at Rehab that I would want our donors to know about.
Well, thanks so much for taking the time to speak with us today. That was very interesting.
Thank you. I appreciate your time.